Hi, my name is Aathavan. I'm a second-year medical student at the University of Queensland and a researcher at the National Centre for Youth Substance Use Research. Before I start, myself and the other authors have no affiliations or financial incentives that could cause a conflict of interest. So a need exists for effective cessation therapies, with the failure of traditional NRTs exemplified by their high rates of relapse. Adverse effects are commonly cited as the cause of discontinuation for cessation therapies. The development of electronic cigarettes has led to their therapeutic use being hotly debated in current times, giving rise to the topic of the current systematic review. The systematic review compares the side effect profiles of traditional NRTs such as patches, gums, lozenges, sprays, with electronic cigarette nicotine delivery. We hypothesize that due to the relative similarity of nicotine delivery between electronic cigarettes and combustible tobacco, that electronic cigarette adverse effects will be more tolerated and thus less reported. Comparatively, due to the alternative nicotine delivery of NRTs, reported adverse effects would be greater. So to investigate this, we searched PubMed, Web of Science, and PsycInfo for papers looking at the adverse effects of electronic cigarettes. We compared this to an existing review on the adverse effects of NRTs by Mills et al. So our results found that oral irritation, dry mouth, flatulence/hiccup, nasopharyngitis, and cough were the most commonly reported adverse effects of electronic cigarettes. Comparatively, the most common adverse effects of NRTs were skin irritation, cough, vertigo, insomnia, and nausea/vomiting. A direct comparison of the adverse effects of NRTs and electronic cigarettes shows that ECs are associated with a greater incidence of oral irritation, cough, headache, and insomnia. Contrarily, NRTs were suggested to be more prone in inducing vertigo. So the results contradicted the proposed hypothesis. Contrary to the hypothesis, electronic cigarettes use was associated with a greater incidence of adverse effects. Moreover, electronic cigarettes were more likely to result in a greater report of common adverse effects, with exception to dizziness. This current review reported raw frequencies and did not quantify the severity or level of impediment. While EC's adverse effects may be commonly reported, they may not deter the continued use due to the familiarity in the method of inhalation nicotine delivery. Contrarily, due to the unfamiliar form of nicotine delivery in NRTs and the atypical adverse effects compared to combustible tobacco, adherence to NRTs may be lower. Future work could look to explore the level of impediment associated with the reported adverse effect and its subsequent effect on adhering to cessation therapy. Additionally, quantification of not only the adverse effects, but also the favorable effects could provide greater strength on the effectiveness of cessation modalities. Thank you.